Namaste. I welcome you all to this 18th session of Gurubodha. We have with us our Ayurveda Guru, Dr. M.D. Guru Raja sir. First topic of the day is Medhya Rasayana. So, Rasayana is the anti-aging and rejuvenation chapter in Charaka Samhita Chikitsa That is the treatment section of Charaka Samhita. So before Master Charaka goes on to explain regarding treatment of various disorders, so in the first chapter itself he explains, how to prolong aging, how to live healthily for a longer period of time. So the preventive aspects are given importance there. So in the Charaka Samhita Chikisasana first chapter, there are 4 sections. In the third section of the first chapter, that is 1.3 chapter, we can say, the name of the chapter is Kara Prachatiya Rasayana Pada. In that, this shloka is beautifully mentioned. So this shloka says, Manduka Paranyaha Surasaha Prayojyaha Kshirena Yasti Madhukasya Churnam Raso Guduchyastu Samula Pushpyaha Kalkaha Prayojyaha Khalu Shankha Pushpyaha Ayuhu Pradani Amaya Nashanani Bala Agni Varna Swara Vardhanani Medhyani Chaitani Rasayanani Medhya Visheshena cha Shankapushpi. So this explains regarding the Medhya Rasayanas, which have become very famous. Medhya means to improve brain functions, memory, intelligence. So I request Dr. Guraja sir to decipher this shloka for us and explain the meaning, sir.
First of all, we should understand before going to the topic of this, particularly these why these drugs have been mentioned as medhya and all those things. We need to understand what is medhya, what is medha. So when we try to understand this medhya or medha, it has 3 components. One is grahana shakti, the other one is dharana shakti, and the third one is smarana shakti or smriti. So if these 3 component, dhi, dhriti and smriti, if all the 3 together, then only a person will have a proper type of knowledge or intellectual capacity or even medha, whatever we call it as. And when we understand, try to understand and look into the various aspects of the explanation given in Ayurveda classical texts, we find that Medha is one of the Prakrita karma of Pitta. Medha is Prabha Prasado Medha cha Prakrita karma of Pitta. It is explained. So similarly, while explaining the Prakrita karma of Kapha, it is said that Dhriti is one of the Prakrita karma of Kapha. So then when these 2 things are there, then of course we need to understand that all those drugs which enhance Pitta and Kapha are definitely going to act as Medhya. But that is not the truth. The truth is something different. Acharya very clearly said, Medha or Medhya is a Prabhava Janya Karma. So very clearly it has said, Medhya is a Prabhava Janya Karma. That means Medhya is due to Prabhava, and we all know that Prabhava is Achintya Karma. It cannot be explained as such. How we could able to explain that a particular function of a drug is due to its rasa, guna, virya, vipaka and so on. Such type of explanation could not be offered to those type of functions or the pharmacological actions brought about by a drug which falls under the category of prabhava. So it is achintya in nature. It cannot be systematically or scientifically explained why this is being doing like this. We can say that this is a typically basic nature of the dravya or the drug. It is the basic nature of the drug which is responsible for the medhya function. So now we come to that medhya, why there Manduk Parani and Esti Madhu and Guduchi and Shankapushpi, these type of drugs have been explained. Of course, here Acharya very clearly explained the 4 drugs, that is Manduk Parani, are very popularly known as Vandelaga in Karnataka and in Net and everywhere in the Western world. And technically, it is a Centrala Asiatica. This is a very small herb, and very clearly said, Swarasa of that drug has to be consumed. Whereas in case of next drug is Estimadu, where he says that Estimadu should be, the powder of Estimadu should be mixed with milk to have a Medhya Rasayana effect. Similarly, the third drug is Guduchi. Once again, the Swarasa of the Guduchi has to be given, its entire root and everything. And in case of Shankapushpi, should be consumed in the form of Kalka, that is a paste. Why Acharyas have said this? See, first of all, when we try to question like this, we also try to understand that how the knowledge has been imported in Ayurveda. In the Ayurvedic classical text, when we go through that information, we have been provided with information by three modes. One is by Pratyaksha Pramana, the other one is by Aptopadesha, and the third one is Anumana. Here, this particular information provided by the Acharya is falls under the category of Aptopadesha. We see nowadays, whenever we are in a 21st century and we are in such a state of affairs that any information, if it is there, I try to block it, or I try to secure it under the intellectual property rights. But our acharyas, they are very lenient and very generous. They are given a huge information without any cost. They are given lot of information about these things, and they are aptas. We all know that who are aptas? All those who are free from raja and tamas. They are free from rajas and tamas. Such a person is an apta, and these aptas, they are given information for the benefit of the mankind. So when such information has been provided for the benefit of the mankind without charging any fees for that. So this is the beauty of their information and the knowledge what they are given, and whatever the knowledge they have shared, they might have experienced a lot of failures before they come to a conclusion. So in this statement also, if Acharya says Shankapushpi is the best among these things, means we need to accept it. Otherwise, until unless we have to disprove it. So if Acharya says it is Shankapushpi, it is the best among the Medhya Rasayanas, they might have used all other options what they are available, and then their pratyaksha, they might have understood it, and then they are giving the result or the outcome in the form of statement that Shankapushpi is the best or the excellent for the person to increase the medhya of a person. So we need to understand in this sense that medhya function is due to prabhava and is achintya in nature, which cannot be explained in as such. That's why there are plenty of drugs has been explained as medhya. Out of them, some of the drugs are Ushna in nature, and some of the drugs are Shita in nature. Some of the drugs are Katutikta Kasharasa in nature, and some of the drugs are having Madhurasa in nature. Some of the Vipaka is Madhura, some of the Vipaka is Katu. So we get all sort of a wide range of drugs which all falls under the different categories. But there are two important facts we need to understand, that those drugs which try to improve the pitta of a person, which helps in grahana shakti and smarana shakti, grasping, that is a learning, as well as recollecting. For that purpose, usually all those dravyas which are little bit ushna in nature, they will going to support it. Similarly, if you want to retain the information in your brain, for that purpose, dharana shakti is required, and that dharana shakti has been enhanced by all those which are madhurvipaka dravyas or madhurasa dravyas or shita virya dravyas. So we need to understand in this concept and this category that this is typically medhya dravyas. They are not just like any other action. We can explain how it is functioning, which drug is doing in this way or that way. No, it is purely achintya shakti, achintya virya, and it is a purely prabhavajanya. Hence, it is the basic nature of the drug which behaving like medhyas. Even Shishruta has given vidanga Chitrakamula, Apamarga, and even those drugs are also as Medhya. And we can even find like Kushmanda and even Suvarna. These are also Medhya. There are also plenty of Vacha, Ashwagandha, Madhu. There are plenty of drugs which have been explained and here and there in the name of Medhya. So it cannot be simply just because one category of drugs have been considered as Medhya, and no, it's not like that. We have a wide range of drugs which falls under each and every category. It may be Madhur Rasa, even Tikta Rasa, Katu Rasa, with Kashaya Rasa, Ushnavirya, Shitavirya, Lagu Dravya, Snigdha Dravya, Pichila Dravya, all sort of Dravyas are there. But it is basically we need to understand that this is a very typically basic nature of the drug. That's why they are behaving as Medhya Rasayana, and it is being observed by our acharyas by Pratyaksha, and now they are passed on the information as Aptopadesha. So we need to understand in that sense.
Thank you for the elaboration, sir. And in the shloka itself, these Mandukapani, Lukarais, Guduchi, and Shankapushpi, they have been explained. Ayu Pradhani means they improve the longevity, Amaya Nashanani, cure various diseases, Bala Agni Varanaswara Vardhanani, meaning promotes strength, skin health, voice. So these are all covering various points of Rasayana function. So these are also Rasayanas plus Medhya Rasayanas. But we do not see much use of, say, Mandukaparani or Shankapushpi as Rasayana. And also you mentioned that Acharya Sushruta has explained Vidanga also as Rasayana. And Ballataka has been explained as Rasayana. So the concept of Rasayana is very wide, and not only just like Rasadhatu promoting and nutrition rich, sir. It's like very wide with varieties of functions.
Of course, Rasayana Dravya has its function in all the system of the body. That's why it's like Labhopayohi Shastanam Rasadinam Rasayanam. It is the one which gives support to all sort of tissues. Dirghamayu Smruti Medam Arogyam Taranam Vaya Prabha Prasado Swara Indriya Bala Varna, everything. You just count it, everything all comes under the purview of Rasayana. So the drug which is having a totally a positive effect on the body and providing support to each and every system of the body, every system or shotas of the body, and such a drug is Rasayana in nature. And of course it enhances positively all the aspects of the body, and that's the reason it tried to maintain the youthfulness in the body. That is the reason that Rasayana, the concept of Rasayana has been developed, that we need to maintain the youthful status of the body.
So these, this Brahmi, Shankapushpi, Jyotishmati, Celestis paniculata, Jatamamsi, Licorice or Vacha, Ashwagandha. So these are considered as Medhya, and these are also equally used in the treatment of depression, anxiety, phobia, mania, or schizophrenia. So these are also used in to improve the brain functions and also to correct pathologies related to brain and mind as well.
See, definitely these dravyas, they have a special action on manas. So once again, it's a big topic in Ayurveda. What is manas? Where it is situated? So very clearly it is said manas is present all over the body. Sometimes it is said mana hrudistitaha, it is present in hrudaya. Then comes the question, where is hrudaya? We have different varieties of hrudaya, shiro hrudaya, uro hrudaya, tala hrudaya. So when it comes to such a type of understanding that wherever there is something as acting as a center which is receiving the information, processing the information and giving it back in the form of a feedback. So any center behaving that type of thing is treated as Hrudaya. So it may be for a blood or it may be for the Vatanadi. So similarly here, Manas is connected with the Vatanadi and it is connected with the Mastishka. That's the reason many a times lot of confusions are created regarding this, that whether manas is present only in the brain or the we should take it as only brain or it is not in the heart or something like that. But according to Ayurveda, manas is present both in Shiro Hrudaya and Uro Hrudaya. So we need to understand this part first. Second thing, whenever we are using these drugs, definitely it improves the functions of that area. It may be talo hridaya, or it may be ruvro hridaya, or it may be shiro hridaya. So definitely these drugs will going to help in those pathologies which are related to those organs. Not only schizophrenia or maniac or this type of things, it is also even the improvement of the cerebral functions, or even the grasping, learning, retaining the information, recollecting, processing, and even the taking a decision, which is right, which is wrong. All these process is done by brain, and these functions with the support of manas. Very clearly said, Jnanendriya gives information and Karmendriya has to perform a karma. Before that, there will be always come with Ubhayendriya, that is Manas, which makes the churning and understanding what should be the response and how it should be understood. All these things done by Manas. So when a drug is capable of influencing the Manas, definitely it will be influencing the Vatanadis. So also the Vatanadi functions is basically in such a way that it is connected with the Shiras, and that is related with the Shirohridaya. So definitely we need to understand this, and accordingly we should go for it. Similarly, when the drugs like Jyotishmati, drugs like even Sarpagandha, Jatamamsi has been explained to be used in various mental functions and diseases. Definitely, it has its own effect on various part of the body, but its special effect is always on the brain or the Vatanadi functions. So definitely, we need to understand this part. When the drug is capable of acting on a Vatanadi, definitely once again it is a Prabhavajanya. It cannot be considered as just like any Virajanya functions.
Thank you, sir. And like Acharya sir explained that heart or Hridaya is also explained as one of the places for manas. I just came across a research which says, which largely discusses on personality changes following heart transplantation. And I also came across another point of research that 6% of people who have got heart transplantation, their personality changes. So the change of heart, the change of personality is also kind of evident. So there lies a little bit correlation. Of course, it's a matter of research, but there lies some hints regarding our heart also being a site of manas.
Definitely. See, there are so many type of explanations are there, but if you observe that there are certain occasions where manas is situated in heart, which we can prove it. For example, a businessman is there. Suddenly he gets a news that his factory is under fire. Then he, instead of getting something like a maniac, he gets an heart attack. So which very clearly suggests that where is the mind. And in the other terms, we always symbolize love with the term of a heart and all those explanations. But whenever there is a love failure, we don't find any heart attack. We find the person becomes schizophrenic or maniac. So it's quite different, that the way we depicting the things and actually it's happening is entirely different. So in Ayurveda, the said means it is there in the heart, and it is manas is situated in hridaya. That we need to be understand that, and we need to accept that, because it is a aptopadesha pramana.
I've seen, many business successful people. They say that, most of the decisions which come from your heart rather than the technical analysis and all. So those decisions are usually successful rather than doing just technical analysis and just going by the numbers. Coming to a few questions that have come in the chat box here. Dr. Savitri asks, so Guduchi being hard, how can we take out the juice of it? There are many different methods of Sorasa extraction explained in detail in Sharangara Samhita. So one is that take the raw drug, fresh drug, and use extract the juice. So that is one way. And another way is take the coarse powder of it, add 8 parts of water, and boil it and reduce it to half. So this is another method, and another method is like putapaka. So out of that, if the Guruti is not yielding out juice extract, probably we can take the powder of it, fresh powder, fresh herb powder or dry powder, add 8 parts of water and boil it and reduce it to half. sorry, reduce it to quarter. So this itself is legally a form of Swarasa as per Sharangara Samhita. So your comments, please, sir.
But the Acharya Charaka's explanation here in the Medhya Rasayana concept, it is very clear that we need to select a fresh drug and which could be able to give out Swarasa very easily by just by crushing it. So here the juice of Guduchi means we need to take the Guduchi which is a very fresh and which could be able to yield the juice on crushing. So the other modalities, as you told, it is right. We can, when there is an, we were unable to procure it, so in the form of a fresh drug, when we can go for all the other alternatives of Putapaka and all these boiling methods and getting even that type of Swarasa. It is also accepted technically as Swarasa. But here actually Acharya Charaka's intention of saying that it is a juice, it is right away fresh one, and it is to you should select a Guduchi of such thickness which is not so hard, and it is be able to produce the juice. It should be tender.
And also, this, our ancient acharyas, they do not care about difficulty of a doctor or difficulty of a patient. So if it is juice, you go and get juice. If your Guruji is not yielding juice, then find out the Guruji which yields juice. It's do it or don't do it.
No, it's a very typically the mention means they have done so many experimentation and then only they are given out the final verdict. It is not like presently when we do many experimentation on patients, we have seen that many a times our calculations go wrong, and ultimately when we make a conclusion, then the result comes. Then we stick on to those type of things, and we'll continue with the same thing with other patients also, similar type of patients. So this is very typically acharyas have done all these homework, and then only they are given out this information, and it is being given after a lot of churning and given all the keeping aside the failures. They have given us only the positive yield, which is going to give us the benefit. So we need to understand that part of it. And when they say that it is a Swarasa means we need to stick on to that Swarasa. That's it. We don't want to just dilute it by other means. Try to do it whatever they said. Aksharasaha Satya. Whatever they have said, it should be stick on even to the point. You should not violate it or just bypass it.
Going to the next question in the chat. So, which herbs show recovery in cerebral atrophy and also in mania? I mean, there are two different. This one, let's take up cerebral atrophy, although it's a topic on its own. Just your quick words and remedies or treatment modality for cerebral atrophy, sir.
See, typically cerebral atrophy, if it is occurring as per the age, senile atrophy, then it cannot be rectified. It can only be postponed. If it is a premature atrophy, cerebral atrophy, maybe due to some disease, if the condition is that we try to analyze whether that atrophy is what mean the lines of doshic imbalance, it could be able to be rectified, then the same Medhya Rasayanas will definitely yield the results. Particularly, we need to improve. Atrophy means you just observe that if there is an atrophy means there is a tissue under degeneration. It is going to reduce. The Kshaya Avastha of the tissues is there. So if the Kshaya Avastha is there, then we need to go for the Brahmana. We need to give nutrition and make it regenerative. So for that purpose of regeneration, we need to select such type of Medhya Rasayanas like Ashwagandha, Estimadu, Shatavari. These will definitely will support it. And of course, augmented with that with some of the like what you call Brahmi or Mandukaparani. These things are even Jyotishmati. If it is added on to that, definitely it will improve the condition. But in case of mania, once again, lot of counseling is required. We need to understand and analyze the doshic imbalance in that, and even we need to understand the person's basic nature of his ability of handling the issues and how he was previously, what is his rajas and tamas. So and whatever maybe his sattva, whether his sattva can be enhanced by medicine or by counseling or some other means or puja or something rituals, whether we can go for some sattva vajaya chikitsa, whether we can go for some Mani Mantra Chikitsa, whatever the things, whether the person believes in some, all those things, all these aspects to be taken care of just by simply giving some drug or some herb. We cannot simply change the things. It cannot be possible. And many a times it is a complex issues, and these complex diseases and issues require a complex protocol of treatment. It doesn't basic just by putting some single herb we can alter the pathology. It is not possible. Only thing is that regularly consuming Gotukola or Mandukparni in this part of the world, like South Canara and Karnataka, we use regularly this Gotukola in the form of tambli. We prepare a special preparation of that with the curd and all those things, and that is being used. And definitely it will be good. And even in this part of the world, we people use kushmanda in the form of a particular dish. It is often used, and this is also very good. So we need to understand these things, and people consume gritha regularly. Gritha is also one of the Medhya Rasayana.
Thank you. That's moving on to the next question. Some of these Medhya Rasayanas are also good for neuromuscular disorders such as multiple sclerosis, etc. Can these be given for someone who has Kapha related issues as well?
So definitely, see, entire body has a lot of issues. There may be different type of doshic involvement, but we need to assess. There is one typical way of understanding this. This is called as amshamsha kalpana. We need to go for it. So whenever a patient comes to us, we need to list out all the symptoms what he is quoting, and then try to understand based on the lakshanas for which category this lakshana will fall, whether it is due to pitta, vata, kapha. Then out of vata, if it is there, you try to understand whether it is due to pranavata, whether it is due to udana vata, whether it is due to samana vata, whether it is due to apana vata. Then when you go to specific things, then accordingly go for a treatment. And of course, the treatment protocol is includes all sort of different in a different type of what you call patya patya, as well as even the shodhana prakriyas, and all these things are there. So we need to understand basically what exactly it's happening inside. Analyze based on the dosha, then make amshamsha kalpanas, list out the lakshanas, then accordingly take out the things. In a neuromuscular disease or anything like that, if it is giving, you just make a list of this. In that neuromuscular disease, you have understood that. And simultaneously, if a patient has something problem with the kapha somewhere else, you want to add some drug for that, you go and add some drug which is suitable at targeting it to that particular lakshanas. There is no harm. But these drugs, that is the typicalness of Ayurveda. When we combine the drugs for a particular thing, it doesn't harm the other function of the drug. Drug-drug interaction, the beautiful explanation is there in Ayurveda. For example, inside a drug itself, you just observe that. For example, I will quote Pipali. Pipali is Katrasadravya. But a Katrasadravya should always increase Pitta and should always be with very caution. It should not be given in acidity, Amla Pitta. But Pipali is given in Amla Pitta with honey. The reason is Pipali is having Madhura Vipaka, and usually a Katrasa Dravya can become a Vrishya, but here Pipali is Vrishya because of its Madhura Vipaka. So it's very clear Madhura Vipaka of Pipali is functioning simultaneously. The Katurasa of Pipali is also doing its action, but when it comes to a particular question of whether Vrishya should be blocked by Katurasa, then the Katurasa won't come in the way of Madhura Vipaka, which is yielding Vrishya Karma. This is the beauty. Even though they are existing inside the same drug, but different components of the drug, they don't disturb one another in doing any work. If it is required, then they go for a synergetic effect. But if it is a conflicting qualities, then they don't come in a way of a particular function brought about by particular lakshanas, particular gunas. So this is the beauty I explained in nature based on Ayurvedic principles.
A medical student lost her mother 2 years ago, experiencing mild depression. She also has put on a lot of weight in the last 2 years, probably due to depression, and experiencing hair loss, drop in energy levels along with sciatica. what would be the best Medhya Rasayana in this case?
See, we need to assess here. She is a 26-year female. Maybe a triggering factor is there. 2 years ago, she lost her mother and experiencing a depression. But why she is putting on weight, we need to understand that. Whether she has any issues with the thyroid, whether she is suffering from any endocrinal dysfunctions like PCOD or something like that. So that part has to be checked up. Then they observe their hair loss is also there, drop in energy levels, enthusiasm, and of course she is putting on weight. Maybe some strain she might have done. That's a sciatica pain is there. And in this condition, why we need to go for a Medhya Rasayana? Medhya Rasayana should be given just for to tackle her depression. Whenever there is a depression experience, then along with that, counseling is also important. Simultaneously, when you are giving Medhya Rasayana in this case for these depression and all the issues, simultaneously we need to even concentrate on the part of why she is gaining weight, why she is losing her hair, and why there is a sciatic pain. And all these should be separately handled. So it's not only simply by giving Medhya Rasayana everything will go off. No, it is not there. So if sciatica is there, then we may have to go for assessing it, whether it is simple thing, or whether there is any IVDP, or whether there is any disc prolapse or herniation, or maybe due to, or even the simple muscle strain, or maybe we need to assess all these things. Then only we can use a drug. Simply cannot just, when a patient comes with some lakshanas, simply you give some medicine to that. It is not the way of handling. This case has to be taken in a very elaborate manner. Then only you think of adding Medhya Rasayana. And she is already putting on weight means, and if you are putting more and more Rasayana Dravyas, be cautious. That may even further worsen the condition. So what type of Medhya Rasayana you will select, that is also very important. You need to select in these type of cases Katurasa Pradhana Dravyas, not should be Madhurasa, like we should not select Ashwagandha, or we should not select Shatavari, we should not select anything like Estimadu here in this case, which may not be supporting. So we need to be very specific and try to analyze first and understand the doshic involvement, then you can go for it.
If the patient has come for some physical ailment, it can be irritable bowel syndrome or gastritis or headache or anything. So apart from that during the process of case taking, if I suspect that there is some amount of stress or some amount of psychiatric points getting involved in the pathology, I would choose a Medhya herb and include it in the prescription so that, or or counseling, or any of the Medhya methods of treatment would gel well with the physical ailment treatment also, sir.
That can be done. That is the beauty of Ayurveda, and that is the yukti of the physician, treating physician, to select the drug. What kind of drug combination has to be done? Thinking of all Rasaguna Virupaka and Viruddha concept and all those things keeping in mind, one can select the drug, no issues. For example, if any liver issues is there, and along with that, if you need Medhya Rasayana, then you can go for a Guduchi. Guduchi is both liver protective as well as Medhya Rasayana. And there is a atrophy, something like that. Now you need to give a nutrition nourishing. Then you go for a ashwagandha, estimadu. Both they are midrasayana as well as they are promotive, nutritive. Even you can go for davari. So like that, depending upon the type of tissue involved, the condition is involved. Then along with the midrasayana, if you require a brahmana karma enhancing drug, try to select such a drug which has been given all these functions together, and which could capable of handling these issues in a very scientific manner, and which can be done in a conclusively with the single drugs or few drugs only. We could able to assess and address all the issues.
These are all the functions or the benefits that are explained for Shankapushpi. So it is told not only as Medhya, that itself is there. So it is Medhya, Rasayana. Apart from that, it is Kasajit. Apart from that, it is told as Vishahara. It is useful in Apasmara, Unmada. It is told as Chartihara. Also, it is Sara, and it is Vrishya, Smrutipada, Kantida, Balada, Agnida, Kustada, useful in skin diseases and all. So probably if a skin disease with Krumi with say anidra or so in that probably Shankapushpi is useful. So that's why a single herb is explained with many different functions of affecting many different systems. So
No, definitely. We need to understand the basic nature of the drug. That's the reason I told in the beginning. We need to understand the basic nature of the drug, how the drug behaves. Still, there are a lot of issues with this. Problem is, we know that these are the textual information that this drug works in this way. Then comes the real issue of procuring those drugs. Identifying the herbs from the field, collecting it personally is one issue. But you cannot do every time like that. You may be having a constraint of time. Then you may have to depend on somebody. Then they have to get it right one. Or if you are dependent on a market, then your drug vendor or provider, raw drug provider should give you a right kind of drug. That you should be able to identify it. And then it is a big issue whether the drug which is given in the form of a dry thing, whether it contains its real viryata present in that or not, that has to be understood. Sometimes like those which are having some volatile property or something like that, they will be extracted and then it is the things will be given to the market. There are lot of issues are there to understand and to cope up with that. Better as far as possible, try to get it personally. Of course, not all the drugs can be collected from your own places where we are staying. Sometimes we need to depend on market. We need to understand and depend on reliable resources and sources for the drugs. So, if you identify and understand the drugs in their totality, then we have a liberty of and a scope for where which can be used.
I also remember Vaidya Subhash Sharma from Delhi. He says that Ayurveda doctors should have a regular practice of visiting the local bazaar, local vegetable market, to pick and choose varieties of different herbs that are there, so that a combination can be made, especially addressing the patya and all. So it's not just selecting medicines readily available in the market. So the raw herbs, locally grown vegetables, we should be having knowledge of many different things. So,
Not only even see in, locally available vegetable. When it comes to such things, I usually go to market and I observe. Previously, few years back, we used to get a type of beans. Now in market, we have single beans, double beans, ring beans, French beans. There are multiple things when a new thing, some agro technique and some agronomist has come out with a new hybridization and something which yields more, people have grown and it has come to market and it has been pushed and we are forced to consume them as a locally available vegetable. Then comes the issue or question where to keep it under the Ayurvedic category, whether that is what the Ayurveda said kulatha, whether it should be as kept in arhar or where it is to be kept, mudga or vanamudga or something like that. So we need to understand because the Ayurveda has given some explanation regarding these drugs and the new drugs has been that's what the avyakta dravya has been added and such type of avyakta dravyas we need to update ourselves and we need to keep them in category of particular type of thing, whether it is vata vardaka, whether it is kapha vardaka, whether it is pitta vardaka. Like that, we need to assess and keep it in kept category. Then we can give a very clearly we can give out the information to our patient. Otherwise, it will be very difficult when a patient questions that whether it can be taken or not, or how long it should be taken, or whether it should be taken with this combination or that combination. Then doctor will be at risk of answering what to answer, what not to answer. So it should be very updated every now and then. We need to go to visit to the market. We need to select the drugs as well as the herbs, vegetables, and a lot more things. For an Ayurvedic physician, that's why Ayurvedic physician or practicing Ayurveda is not so easy. We need to have a lot of issues. It is not just something like we have some ready product available market. You just have to give a prescription and the things will happen. No, it is not like that.
moving on, the question is kindly advise for the laboratory report says ischemia changes and related complications in MRI brain. Just your thoughts on this, sir.
So definitely, if there is an ischemia and patient is still able to survive means There are already alternative channels which are opened up. That's why he's surviving. So our intention here is to improve the blood circulation. So we need to go for a Pramati Dravyas. So all those Pramati Dravyas in our list is Vacha and Maricha. Then comes Amla Rasa Dravyas because it is said Amla Raso Hrudhyana. And we have seen even many a times Amla Rasa, if it is put into mixed with blood doesn't gets clotted. So that's why Amla Raso Hrudhyanam. So we need to understand that there is some Amla Rasa Dravyas and Maricha and Vacha and such type of drugs are to be taken. Then we have another list of drugs like Lekhaniya Dravyas explained in Charaka. So these things are taken and make a combination, and these dravyas like Chitraka, even Musta, these drugs can also be used. Even Pushkara Mula, they help to open up the channels and Shrotasas, thereby improves the circulation. So if ischemia is there and patient is able still surviving means there is some alternative Vasta already it is there. That's why he is surviving. So, but anyhow, in order to improve the conditions or the blood circulation, we have these things at our disposal. That is Pramati Dravyas, Amla Rasa Dravyas, and Lekhaniya Dravyas.
And also, if there is already ischemia, so some part of the brain will be deprived of resources. So some amount of brain nourishing herbs might also help, sir.
Definitely, it will help, but we need to understand that since how long this issue is with, whether it's a fresh case of ischemia or some problem with the heart. I mean, yesterday was normal, today morning he developed and went for a MRI brain or something like that. So all these things, whether it is old, sir, it is from the last 6 months, then it is already damaged. So we need to understand whether it is a fresh one or an old one. If it is a fresh one, a fast action should be done to retain the things. Otherwise, the things will slowly deteriorate. Particularly those areas of brain which is deprived of circulation, definitely there will be hampering. But a person is having a mild issues with neurological things, has secondary to ischemia in the brain, but he could still able to do the things means his brain function is being retained by alternative channels that we need to understand. But to support the main channel, we need to go for the opening up of these blocked areas and to improve the circulation. So at our disposal, we have Pramati Dravyas and Amlarasa Dravyas and Lekhaniya Dravyas.
Moving on. So when using juice of Gotukola, how much dose is given on a daily basis? Would it be helpful for people with Alzheimer's or dementia?
See, because it's a Gotukola is not a which can fall under the category of what do you call nutraceutical. We can say it as nutraceutical. How much ghee can be consumed by a person? It is depending upon one's capacity to digest it. Similarly, if a person is able to consume Gotukola, how much he can consume? It is up to his capacity to digest. But as a drug, how much it can see same Gotukola, we use it in the form of tambali, what I said in the preparation. A lot of things we eat it with rice and mix it and eat it. And there's no question of any dosage you've been calculated here. It is used as a food. So once which is used as a food, I don't think so it is going to cause you any trouble or it might going to cause you any problems. So don't worry about consuming Gotukola in some tolas or something like that or measuring and eating. You can go it in a quite a good dosage, nothing to worry. But singly, if it is taken as it is as Swarasa and all those things, restrict to 10 ml because it is tikta in nature, taste wise, and of course you are not suggested what is the age of the patient. So as out of just deadline, I mean as higher end of the dosage, I am giving you 10 ml Swarasa, that will be fine. If a person is of Medhasvi Purusha and very strong personality with 100 kilos of body weight or something like that, then you can increase the dosage, no issues.
Yes, sir. As Shanandara Samhita has mentioned, out of the Panchavidha Kashaya Kalpanas, Surasa, Kwata, Hima, Fanta, and Kalka, Surasa is the heaviest. It's more guru. So 10 ml, makes so much sense there. Thank you so much, sir. So I just want to touch base upon this patient referral thing. My questions to you, Guru sir, is it the right decision to refer when we think that patient will be better handled in a higher center? How to write the referral letter? What are the points to cover? What are the common mistakes that we generally do to avoid it? And is it a matter of shame that we are not able to handle the patient and we are referring? And what to tell to the patient while we are referring? Can you please elaborate on this point?
See, it's a very important thing. If in a right time, if a patient is referred to a right place or a higher center, definitely the person will survive. The patient will survive. So we need to assess and understand whom to refer, where to refer. We should not feel shy or shameful while referring. It is not a matter of shame. It is a right kind of decision that you are referring the patient to a higher center because he needs or she needs a better management or institutional care or something like that as a higher center where they handle such cases on a periodically on a daily basis. So when such a matter is there, then we need to send to the those type of things. So usually we send refer the patient only two things. We send the patient if the patient requires such type of treatment, which can be handled or done at the higher centers or institutional care for that purposes. Second thing, we will refer the patient to a doctor of particular nature because he has handled such type of cases previously and we know that he is handling those type of cases and he can handle them better manner. So in those two conditions we usually refer the patient to higher centers or better doctors. Second thing, while referring the patient, what we are supposed to write, just refer while writing, basic information has to be there, like patient name, age, and so, suffering from what the initially what we have understood or identified in the patient is suffering from so and so condition. He requires a special care or emergency basis management. That's why I am referring the patient for you for the further management and your opinion. So like even like that we have to write. It's a simple methodology of writing it. We don't want to even write all the information whatever we have lengthy postcard. It is not required. Simple, what the patient name, age, and what you suspect that he is suffering from. With that reference, and why you are forwarding it and referring it. That can be very right kind of referring a patient to the higher center. Then mistakes. Many times when we write referring letters, in that we will also try to give out our findings. Sometimes that findings may be a wrong finding or maybe sometimes we write some diagnosis. That diagnosis may also be wrong. Then that's what we are supposed to write there. There is this person so and so XYZ is aged about so and so is suffering from this things and I suspect a probable diagnosis of particular disease name, then that's why I'm sending this person to you, referring this patient to you for better management and higher your opinion and better management. So like that, if you send the patient to a higher center, that will be wonderful.
And especially when the patient's life is at stake, that say you are suspecting a case of ischemia or ongoing heart attack and all. So rather than just speculating on your own and trying your own remedies, because higher center care is very much required there, and along with that, some investigations are to be done to find out really what is happening. So they're better to refer, and in a bigger hospital, they'll be having both the diagnosis part and the surgeons and other cardiologists will be there. So sometimes these referrals can be life saving. So we should be open to refer. So.
Definitely, we should be open to refer. We should not feel shamed while referring because many times Ayurveda very clearly said, Vaidya Samuha Nissam Shekaranam. There will be Vaidya Samuha. People there will be 4 doctors, 7 doctors, a team will be attending on the case. So if you refer to that, then there will be people to take care of the things. So we should not feel ashamed or something like that while referring. Referring is an art. If you refer the patient, in a right time, in a right place, then it will going to help the patient in the way he can be sustained and he can be allowed. I mean, his life will be at stake, and referring the patient in the right time may even save his life. So we need to be very clear in these things. Referring should not be any, we should not feel bad or something like that I am unable to diagnose or I am unable to treat this condition. Why should I refer? And what is this? No such issues. First and most primary importance for a physician is to sustain the life of a patient. That is a very important. If life is at risk, we should be very fast and free in action. I should be swift in action, and so that the patient life is sustained or survived.
And sometimes we Ayurveda practitioners may get into trouble because we did not refer a case in the right time. Something may go wrong and a patient may go into cardiac arrest. And I remember, as my memory is serving, you only told this one that patient came and his ECG was getting taken, and the patient was from village side, and ECG was coming and suddenly it stopped. So patient died while the ECG was taking, and the patient's relatives, caretakers, they started thinking that probably the patient died because of some current was given to the heart, and that's your mistake. These kind of serious complications or unexpected situations are better handled in a big institution rather than a rookie Ayurveda doctor sitting in a small clinic.
Definitely. See, in our clinics, we will be having handled by single doctor clinics. So, single doctor clinic will always be having some pressures which cannot be handling these type of things. So, better these type of things should be referred to higher center where there is a group of doctors are there. They can handle it very better manner. So, we should be very clear in the certain things while referring. And of course, surviving of a patient purely depends on the fate of the patient. For your kind information, one of patient came to me with a chest pain few years back. After going through his history, I was very much convinced that he is having ischemia. Then straight away I referred him, go to this particular hospital, get ECG done, and if it is required, get admitted because it's emergency. He was not interested in that. He went home. In the night, he called once again, there is a chest pain, vomiting is there. Then I said, why you are gone to home? I said to go to hospital. He said, tomorrow morning I will go to hospital. Then morning, somehow he survived till morning and he came in the morning to the hospital where he has been thoroughly examined, and they said it is anterior, some coronary artery was blocked and he needs to go for angiography immediately. Angioplasty has to be done and he need to get admitted. He was not ready to get admitted. He came back to me. Then I also gone through all these things. I said, oh, this is very important. You just go and get admitted. These things to be done. Otherwise, your life is at risk. Then he said, money is the issue. Then once again, he stayed for another day without taking any medication. Then I scolded him on the third day. What you are doing? Nonsense. Yeah, otherwise, then you will be at risk. Then I explained the information to his wife. Then they took him to hospital, a big hospital, where he has been subjected for angioplasty and all these things. Later he survived. See, in this occasion, if your Hanebaraha, what you call that, the fate line is so strong that he can survive, then the person who has treated, they said, I don't know how this fellow has survived 3 days without any medication. So it is purely how our life is going to be. Maybe with all facilities are there, suddenly something goes wrong, like Punit Rajkumar. You can't do it. We got everything. He got everything, but he could not do it. But this fellow, even though there was a problem, he continued to survive for 3 days and then ultimately landed in right hand and when operated and everything, and now he still is surviving. If you want to survive means your life is there, Ayu is there, definitely it will be there. And if you are having a bad patch in that, then definitely even a good doctor, a good medicine, a good hospital won't make you the person to survive.
Rightly said. Even I have seen the great Dr. Devi Prasad Shetty stressing on this point. So he being, probably number one cardiologist, cardiac surgeon in Asia, if not just India. So he says he meditates, he does yoga, and he reads religious scriptures like Bhagavad Gita and all, to keep the mind in a stoic manner, because he has seen almost bedridden and dying cardiac patient surviving, and a very healthy looking patient after surgery he dies. So nothing is in our hands to take it to a little spiritual level. It's all, we are just the tools serving divine purposes.
Many a times it so happens, it's very unexplainable. It's very difficult to explain why it's happening so. But Ayurveda has very clearly said Shokha, Bhaya, Kopa, Tapa, and all these things will definitely going to cause damage to heart. So if you want to keep your heart pure, always be smooth, always be healthy, and try to laugh, and avoid all shoka, bhaya, and such type of chinta type of things. So keep yourself in a positive vibrations. That will be always good.
Miss Victoria has raised her hand. Please go ahead, Miss Victoria.
Ji Gurudev Vaidyaji, I just wanted to understand, because you mentioned before about counseling, that it's necessary for depression and etc. I want to understand the Vedic principles of counseling, that beside the sattvic diet, lifestyle, exercise, and behavioral rasayanas, what else goes under the counseling, Vedic counseling? What else do you do with this patient?
Counseling is a very important aspect, because we need to understand what the life is, or we need to make the patient to understand what the life is. Many times these patients have their own understanding that life is something bigger than that. We need to explain them, and we need to tell them that what you are, the unnecessary negative vibrations you are taking into your brain, that has to be kept out of the purview. So when we could able to do that one, that is the part of it. And the counseling definitely will increase the sattva of a person. So our Ayurveda also very clearly has said sattva va jaya chikitsa. It is said to increase the sattva of a person. When a person's sattva is increased, definitely he will be proportionately suppressing tamas and rajas. So that is better to increase the sattva of a person.
So, but that means how you do it beside the diet, lifestyle, exercise, and then is the behavioral rasayanas, which you use them for counseling on. What is the principles? What do you actually do in a counseling session?
Now we do it in a counseling session. Usually we sit one-to-one with the patient along with the patient attendant. Then we go for something like question and answering, and we try to show them some videos or some words or something like that, or discourse with them. All these things will definitely will improve, and we try to analyze by talking to them, and what they feel accordingly we try to go for that. Of course, it's something like a feedback mechanism. What they are giving out, accordingly we will design our words and our sentences, what should be communicated in order to enhance the sattva of the person.
So just trying to cultivate the opposite, that if they are negative, we're trying to inspire them for positive view.
Yes, definitely.